Welcome, future doctors, to another episode of the Future Minority Doctor podcast with Dr. Sulma
and Marina, where we bring you conversations to empower and inspire you to contribute to your community and the world by becoming a doctor.
Hello, future minority doctors. Thanks for being with us today once again, and always excited to talk about doctor stuff that I just didn't know when I was in your shoes as a pre-med student. Generally, people know what a physician is, and generally, they think of all physicians as doctors who have an MD degree. However, there are physicians who hold a DO degree. So we're going to break it down today so that you have a better understanding of the difference between both and how these are two paths that can get you equally to become a physician. Let's start out by first explaining what MD stands for. MD, or Doctor of Medicine, is the degree and title you attain when you complete traditional medical school. That's the degree that Dr. Marina and I have. The traditional medical school teaches allopathic medicine, which is a medical philosophy of learning how to diagnose and treat human diseases. This is often referred to as conventional or Western medicine. DO, or Doctor of Osteopathic Medicine, is the degree and title you attain when you complete osteopathic medical school. Osteopathic medicine has a holistic philosophy that also uses hands-on manipulation techniques on the musculoskeletal system in addition to modern medicine. Dr. Marina, I don't know, did you apply to any DO schools, or did you ever consider, or did you even know about them?
I know. Good question. So I have to admit, I was really ignorant about, the whole existence of DO schools when I was applying to medical school. And I wish I hadn't been, because I think if I had been able to apply to both MD and DO schools, I would have, increased my chances. I would have increased my comfort level with the whole process. And also, I think now, even though I'm an MD, I have actually started to adopt a lot more holistic methods in my own medical practice, and including some of the osteopathic manipulation techniques that DO doctors use. I do something called myofascial release therapy in my pediatric practice. So it's interesting that my my own interests kind of naturally went in the direction of osteopathic medicine, which is a little more holistic anyway, but it's okay. I ended up getting that degree. And once you have either a DO or an MD degree, you can really do almost all of the same, pretty much all of the same stuff. There are some residency programs later on that are more selective, that only take MD applicants, but the vast majority of programs are more open. And so really, whether you have an MD or a DO, you can practice medicine as a physician in the United States. So I was ignorant back in the day, I admit that, but now I know a lot more. And I'm hoping that those of you who are listening learn from our mistakes and our new knowledge about these DO programs, which you should definitely consider.
Yeah, I think I'm in the same places and same shoes as you were. I think when I was an undergrad, I had no idea that DO schools existed, honestly. I learned it afterwards. So I think looking back, when I was looking into this conversation that we wanted to share today with everyone, I thought, wow, if I would have known this, I think I would have applied to both as well. So along the same lines as you, it would have probably opened up more opportunities as well. But luckily, I got into an MD program.
Yeah.
All right. So let's now compare and contrast both schools. So what are the similarities? Well, both require 4 years of medical education, whether you go to the traditional medical school or osteopathic school. Both require you to complete a residency after medical school to practice. And most residencies, as Dr. Marina mentioned, they accept both MD and DO students. Both are licensed to practice full scope of medicine anywhere in the United States. And then although osteopathic medicine emphasizes primary care, they can equally apply to any specialty to practice medicine, just like an MD. Pre-med requirements are overall also the same. For allopathic or MD schools, there may be just additional requirements with students required to take upper division science courses. But overall, both do require you to take the MCAT. So sorry, there's no way of getting away from the MCAT. So now that's just in a nutshell what the similarities are. So let's go over what the difference is. So let's start with just talking about the admissions. So we'll start talking about the DO schools. So just so you guys know, there's about 38 colleges of osteopathic medicine schools in the United States. They are considered slightly less competitive than MD schools, but overall they are still competitive, okay? Just don't think you're easily going to get into these. They are still competitive, but they're just considered slightly less.
Mm-hmm.
The thought is that usually there are less applicants to DO schools, which is the driving factor of why it might make it less competitive than MD. However, there appears to be a rising trend year after year that competition is increasing. With DO schools, the average GPA of those admitted is about a 3.5. The average MCAT score of those admitted is roughly about 503. And then many DO schools require a letter of recommendation from specifically an osteopathic physician, which is different to traditional medical school. So that's just a small difference. And then the application server where you actually apply is different for DO schools. It's called AMCOS, and what that stands for is the American Association of Colleges of Osteopathic Medicine Application Service. And this is different than if you're going to apply to an MD program. Now, in regards to MD schools, there's about 157 medical schools in the United States. It is very competitive. You guys know that already. The average GPA for medical school is about a 3.74, so slightly higher than with osteopathic schools. And then the average MCAT score for medical school, the traditional medical school, is 511. And the application server that MDs use is called AMCAS, which stands for American Medical College Application Service. Now, when it comes to medical education, although they are similar, there are some differences in their structure, as also Dr. Marina mentioned earlier. With the DO schools, students will study the basic and clinical science needed for medicine, just like MD students do. However, they're required to have an additional 200 hours of training in osteopathic manipulative medicine, and that's what we referenced to earlier that involves the musculoskeletal system. DO schools also focus on prevention and holistic care, and they carry a heavy weight on primary care. Now, in contrast to medical schools, with medical schools, the traditional structures the first 2 years is didactic learning on basic science, although some medical schools nowadays are starting to change the structure. And then the last 2 years in medical school consist of clinical training in a hospital or medical setting. It's the last 2 years are the very hands-on with patients. So as you can see, it's a small differences in the medical education, but overall very similar.
Mm-hmm.
Then when it comes to exams, both are also a bit different. So all physicians, they need to take a medical licensing exam. That's whether you're a DO or an MD. So with MD graduates, you're required to take a licensing exam called the USMLE. That stands for the US Medical Licensing Exam. And there's a total of 3 different exams that each MD will take. And we call those the USMLE Step 1, 2, and 3. And these are all required for you to pass to be licensed. With DO graduates, they're required to take a different licensing exam. So DOs have a medical licensing exam called Comprehensive Osteopathic Medical Licensing Exam, or COMLEX. That's how they refer to it. The COMLEX licensing exams also have 3 different exams that they have to pass, and these are referred to as level 1, 2, and 3. Interestingly, though, and this is something I didn't know that I learned, some DOs will also take the USMLE exam in addition to the COMLEX if they're interested in matching any non-DO friendly residency program, or if they're interested in specializing in a competitive field like surgery, ophthalmology, orthopedics, or dermatology. Some will do the first part of the USMLE only just for the purposes of applying to a competitive residency program, but others actually do the entire 3 parts. So some DO students, they will actually take 4 to 6 exams total, which is a lot. And where I work at, my colleague and her husband are both DOs. They both went to DO school. And her husband wanted to match in a surgery residency program. He actually took all 6 exams, but he was able to match, and he's a practicing surgeon now. I don't know if you knew about that before, Dr. Marina.
I had heard about it, but it wasn't until a few years ago when I started to kind of learn more about the DO programs that I realized that part of it.
And then another exam that physicians take after passing the licensing exams are the board exams. And with this, you can also have a minor difference between an MD and a DO. The board exam is an exam you take to recognize physicians as an expert in their area of specialization. Both Dr. Marina and I took the board exam for the American Board of Pediatrics, so we're supposedly recognized as experts in pediatrics. Of course, you're never really an expert when you're a doctor because you're always learning. But many jobs will ask for this board certification, so it's an important exam to take. MDs and DOs can take the same exam from the American Board of Medical Specialties, so whether you graduate from an MD school or DO school. However, DOs do have the option of becoming board certified through their own board, which is the American Osteopathic Association as well. MDs wouldn't go through this other board. Then there's also slight differences when it comes to applying to residency, as we've referenced earlier. Although both DOs and MDs can both apply to most residency programs equally, there are a few DO-only residency programs as well. During my residency in pediatrics, there was a complete mixture of both DO and MD graduates. And I feel like that's most of the residency programs. Perhaps in the future, the DO-only programs will also be merged with MD graduates as well. So something new that I had learned, and when I was talking to my colleague who was a DO, she also mentioned this as well. How about you, Dr. Marina? With your residency program, did you have both MD and DOs?
I did actually. And that's, interestingly, that's one of the first times I started to understand about DO programs, because I was like, wait a minute, my co-residents are here and they know everything that I do. They have the same kind of experiences from medical school. They took similar exams, but they have DO behind their name instead of MD. And, one of my residency colleagues ended up becoming a neonatologist, which is a pediatrician who takes care of premature babies in the NICU. And another one ended up going on to specialize in allergy and immunology. So, we were all pediatric residents together in our 3 years of general pediatrics training. And then they went on to subspecialize. So you really can do a lot. And they were, they were just as good as anyone else. We all worked together as a team. We didn't see that label as differentiating us really in any way. The only thing that I think might have been harder for them is that they got this training in medical school in like a more holistic approach and the osteopathic manipulative treatment, the hands-on techniques. But because they were in a residency program that was dominated by MDs, they didn't really get to use that as much as maybe they wanted to. But that was really the only difference.
Yeah, I agree. That was definitely my experience too. I would say almost half of my co-residents were DOs too. So there was again, and you cannot tell the difference in case you're concerned if you're going to get a better medical education getting an MD or DO. It's really the same. I felt no difference with my DO colleagues.
Mm-hmm.
Then lastly, the cost of going to MD or D school can also vary. So most of the DO programs are in private universities as compared to MD programs that have many programs in public universities. And as all of you know, and you've heard on our previous episodes, private universities are more expensive. This, therefore, then translates into DO students possibly coming out with more debt. From a quick search I did, it appeared that the average debt when you compare ND or DO, a DO will probably come out with $60,000 more in debt compared to an MD student. However, this is a very rough estimate because there's so many variables. For example, there are DO schools that are in a public university, so then that would offset, the difference as well. Or if you go to an MD school that is a private university, because those are going to be much more expensive. And then the other thing is whether you get grants, scholarships, or if you, depending on the cost of living or where the medical school is. So again, this is a big variable too. So I know this was short today, short and sweet, but just wanted to really give you guys an idea of the difference. Again, I didn't learn about this until I think when I was probably in medical school, but got really into learning more about it, just like Dr. Marina did in residency, because I was working actually with DOs. So I hope you all learned something new today about different options as you pursue your path in medicine. Honestly, applying to both types of programs will get you to the same place. Depending on your situation, make sure you are open-minded to different opportunities. Remember that the goal, regardless, is the same, and both as an MD or DO, you will be a physician and be well educated and trained. Peace and love, everyone.